administration of drugs using the intramuscular or intradermal route. To start with, let us proceed on the intramuscular route. So the purpose of this procedure is to provide the medication that the client requires if there are no advanced route available. So this procedure needs to undergo steps such as the assessment, planning, implementation, and evaluation. For the assessment, we will assess if the client acquires any allergies to the medication. So upon checking the record of the patient doesn't acquire any allergies on the medication. And then we will assess the specific drug action, the route, the interaction, the side effect, and the adverse effect or reaction for the ordered medication. And then we will assess our patient's knowledge and learning needs to the medication. We will assess the tissue integrity for the site where we will administer the medicine. We will assess our patient's age and weight for us to know the appropriate needle size and the site where we will administer the medication. And then we will assess our patient's willingness to cooperate. So, good day ma'am. May I clarify po? Do you know your weight po? Okay po. Do you know, may I know po your birthday? Okay po. So, at that age po and weight, we can administer the medication po on your deltoid area. Is that okay with you po, ma'am? So, we will assess the area po. I will do the palpation po. There are no tenderness, masses, and lumps. So, this area po is good po for the administration. Is that okay with you po, ma'am? Okay po. Will you cooperate with me po? Okay po. So, after that, we will proceed on the planning. So, we will prepare all of the equipments that are to be used. So, we will be having our medication record, our medication tray with syringe, filter needle, vial, our alcohol swab, wet and dry cotton balls, alcohol, gloves, sharp container, and micropore tape. So, after that, we will read the medication order against the label of the ordered medicine. So, as per order, the patient will be having influenza vaccine, IM, at 7 a.m., 1.5 ml. So, or 0.5 ml. So, after that, we will read the label of the medication. So, Vaxigrip, influenza vaccine, vacuna antigrippal, so expiration date, January 1, 2022. So after that, we need to make sure to read the label of the medication when taken to the medication tray or when taken to the medication cart. Also, we will read the label before and after withdrawing the medicine. So we can now proceed on the implementation. So we will perform hand hygiene technique or any infection control technique prior to the procedure, and we will start the preparation of the medicine. So in here, first we will read the label, Vaxigrip influenza vaccine, vacuna antigrippal. We will assess if there are presence of cracks. There are no cracks, there are no foreign bodies, and the clarity of the vaccine inside is in good condition. We can start the preparation of the vial. So we will perform the vial preparation. So after the preparation, we will label the syringe with the 5S of or the 5 rights rather of the medication. So we will put the patient's name, the name of the drugs, the route, the time, and the dosage. So after that, we can now start establishing rapport to our patient. So good day ma'am, I am Nurse Curie po and I will be the one po who will gonna administer the medication po on you using intramuscular route. So to verify your identity po ma'am, again, can I ask for your name? Also ma'am, can I ask for your birth date po? Okay po. So ma'am, I am going to administer po influenza vaccine or also known po as the flu vaccine on your deltoid area using the intramuscular route po ma'am. So in here po ma'am, we will administer the medication po on you po. It will provide you po the immunity that you need po. when you acquire flu po. So, this doesn't mean po that you will not have the said disease po. However, it may lessen the complication, or it will lessen the severity of the disease po when you acquired it po. Is that okay with you po, ma'am? So, later po, discomfort will be felt po on the site where we will administer the medication po. So, tell us po when you can't handle the pain, and make sure po to relax your arms po for you to cooperate. Is that okay with you po, ma'am? Okay po. So, after that, we will now provide our patient the privacy that she needs. We will close the doors and the curtains so that our patient will be more comfortable. And then after that, we will now position our patient depending on the site where we will administer the medicine. For the ventrogluteal, we will position our patient into a supine position, knees flex. For the vastus lateralis, we will position our patient into a sitting or supine position. For deltoid, we will position our patient into a sitting or supine position, arms rested or relaxed. And then we will position for the dorsogluteal, we will position our patient into a prone position, toes pointing inward. So, since we will administer the medication on the patient's deltoid area, our patient now is on sitting position, and ma'am, may I ask you po to relax your arm na po? Okay po. And then now is we will start administering the medication to the patient. By first, we will assess the area or the site of administration. We will palpate it. There are no masses, tenderness, and lumps. So, we can now start preparing for the administration. So, first is we will wear our gloves. And then, we will now disinfect the area starting on the inner going outwards for approximately 5 centimeters. And now, we will get the syringe. We will remove the cup into a straight off. We will perform sit-rack motion, or we will spread the skin of the patient. With the use of our non-dominant hand, we will hold the syringe with the use of our dominant hand with the thumb and forefinger. And then, we will pierce the skin of the patient at 90 degrees. So, when the syringe is already inserted, we will aspirate the bebel. And if there are aspirated blood, you need to make sure to remove the syringe and replace the syringe, discard it and replace it. Do this sterile technique again, and then perform it in another side or another site. However, if there are no aspirated blood, you can slowly administer it. So, while performing the zit-rack motion or technique, we will now pierce the skin of the patient 90 degrees. Slowly, smoothly, we will move our hands into the non-dominant hand onto the lower portion. We will move our dominant hand on the upper part of the syringe. We will aspirate the plunger. There are no blood, so we can slowly administer it. We will slowly administer it 10 seconds per ml. So, after administering, we will remove the syringe, remove the sit-rack motion, put on the cotton balls with a gentle pressure. Discard the syringe on the sharp container. You can put micropore tape. And then, after that, we can now remove our gloves, perform hand hygiene, and then we can document the procedure. We will document the medication name, dosage, route, time. We will document the patient's reaction when when the administration is performed, and then we will document if there are any adverse reaction felt by the patient after the administration of the medication. So that ends the intramuscular administration. So now we can perform the intradermal administration. So the purpose of this is to provide tuberculosis test, skin test, and BCG vaccination to the patient. So for the assessment, we will assess the site where the skin test will be performed. So we will assess the site, and then we will assess the specific drug action and the reaction or the expected outcome of the skin test, and then we will assess our patient's knowledge on the outcome and the specific drug action. So ma'am, we will perform skin test po to assess po if you acquire any allergies on the medication to be administered on you po. Is that okay with you po? Okay po. So for the planning, we need to assemble all of the equipments to be used. We need to have our medication administration record, our gloves, our sharp container, dry and wet cotton balls, our 1 ml of sterile water, the medication or the ordered medication, syringe, filter needle, and the alcohol swab. So, after that, we need to read the medication administration order, and we will read the label against the medication. So, the patient will have a skin test for the medication, the antibiotic clindamycin. So, skin test will be performed to the patient. So, part of the skin test solution is the clindamycin antibiotic. Expiration date is on January 1, 2022. So, after that, we need to make sure to read the medication when taken to the medication cart before withdrawing the medication and after withdrawing the medication. So, we will read again. So, antibiotic, clindamycin expiration date is January 1, 2022. So, after that, we will now perform hand hygiene technique to start with the implementation, and then we will prepare our medication. So, here, the medication is already prepared, wherein it requires 0.9 of sterile water and 0.1 of the clindamycin medication. So, before we administer, we will read it again. So, clindamycin, antibiotic, expiration date, January 1, 2022. So, after that, we will now prepare our client. We will position our client, and then we will prepare our client. So, ma'am, we will start na po. I am Koyuri May M. Isidro po, a student nurse of this hospital, and I will be the one po who will gonna perform the skin test po on you. So, to verify your identity, ma'am, may I ask for your name? Also, ma'am, may I look at your wristlet? So, it states here po that your name is Ayana Naku, sex female, bed number 1, date of birth is June 9, 2001 po. Okay po, ma'am. So, ma'am, we are going to perform skin test po. We will test the clindamycin po, antibiotic po. So, we will assess po if you acquire the allergy po on the said medication before we administer the proper or the ordered dose for you po. Ma'am, is that okay with you po? So, you will feel a little discomfort po because we were gonna perform the skin test po. In your skin, we will form a bleb po or a wheal, and if there are any redness present on the area where we perform the skin test, you acquire po the allergy on the said medication. Is that okay with you po, ma'am? Will you cooperate with me po? Okay po. So, after that, we will provide our patient's privacy by closing the curtains and the door so that our patient will be more comfortable and secured as we perform the assessment. And then we will start putting on our gloves. And then, after that, we need to assess the area of the patient on the inside forearm of our patient, we will assess the area where hair is less visible and where we can perform the skin test. So we will assess the area. After assessing the area, we can start disinfecting it by the use of cotton balls and alcohol, starting from the inner corner going outwards. And then we need to make sure to discard the cotton ball, and then we need to make sure to let the area to be dry. So after that, we can now start the administration of the skin test to the patient. So in here, by the use of our dominant hand, we will start the skin of our patient. We will remove the cap of the syringe. We will, by the use of our non-dominant hand, we will position the syringe into bevel up position, and then we will insert it for approximately 10 to 15 angle. We will position our syringe. We will insert 1/8 of the syringe on the skin of the patient. So we need to make sure to insert the syringe only on the skin. Make sure that bevel up, and then we need to see the point of the syringe through the skin of the patient, and then we need to steady our syringe and needle, and then we will now administer the medication. We will need to form a bleb or wheel, and then when wheel is already formed, we will remove the syringe on the same angle that we inserted it. We will discard it, and then we will not massage the area. So after discarding the syringe, we will put on a circle. We will encircle the area where we administered the medication, and then we will remove our gloves, and then we will perform hand hygiene, and then we will put on the medication name and the time of the end of the skin test. Approximately 30 minutes the skin test will be ending, and then we will assess if there are any redness that surrounds the area, or if there are any redness found on the area where we administered the skin test. So after that, we will now make sure to document the findings. We will assess the patient's reaction on the skin test. We will document the the medication administered, the time, the route, the patient's response to the procedure, and then we will also document the reaction of the skin for the skin test. So that ends the intradermal administration of drugs.